agenda, and so I think we should call the meeting to order and do our Pledge of Allegiance if we can.
Somewhere there's a flag.
Flag in my room.
I keep one on a a sticker on.
Oh, here's one.
We good?
Yep.
I pledge allegiance to the flag of the United States of America,
and
to the republic
for which it stands,
one
one
nation,
nation, under God,
God,
indivisible, with
with
liberty and justice
for all.
And with that, has anybody reviewed the minutes? And would somebody like to give me a motion for approval of the minutes?
I reviewed the minutes and there's a couple of questions. On one, it says the township building will open to the public on March 29th. Do they meet May 29th?
That's probably correct. And if you would put in your minutes, we'll check that out. We'll check that with Maria. I'm pretty darn sure because it did.
Okay.
No, they actually, because they've been open to the public. So it may have been since March 29th.
Okay.
Right.
Okay. So then it was open.
So let's
Yeah.
leave that
Okay.
intact. Okay.
Oh, no, instead of will, it has to be was open.
Fine.
Or began to be, began to open.
Yeah.
So
Okay.
we'll submit that with our notes from this meeting for correction of the minutes.
Okay, and then also with the student interns, it says that their survey was stalled and it wasn't stalled. It was, they were unable to execute it.
So another a change in the minutes.
Right. And I think there's one more. Under, our discussion, we also discussed the fact that there's no school representative, no administrative representative from the school district, and that we were going to look into getting somebody in there again. Because I remember the first year I came here, there was a rep, and then last year they just disappeared. So
Right. So I thought that I don't have the minutes pulled up, but I thought that did appear in the minutes. Let me see if I can find them.
looking to bring school district information and context to Board of Health, but not specifically a representative.
So I'd like to get clarity on that if I could.
Okay.
Because was it, which direction was it? We had somebody from the school district joining the Board of Health or somebody from the Board of Health attending school district meeting?
No, there was somebody from the school district. I want to say it was a counselor that used to come to the meetings every month, and then somehow that person disappeared.
So if you would like to make a recommendation for the amendment, for the amendment of the minutes to reflect that, and then I guess that's actually to old business, but I think that, hello, Alex, welcome. Thanks for joining. The question is, and I would ask Maura about this, how would we go about with an election tomorrow, or I guess a primary election and elections coming up, that could all change, but how would we go about making that request? Who should I'd be more than happy to reach out, but how would we do that?
Yeah, I'd like to look back in the minutes from maybe 2 or 3 years ago and find that person who was the representative. And if that person is still working there, and for the school district, contact them, and or whoever has taken his place to contact them.
Jane, I think he left. That's the reason that our liaison disappeared.
Right. So then we never got a replacement.
Right.
And I think that's a very valuable, person to have in on the Board of Health meetings. So I don't remember what his position was, but I'm just wondering who it would be that we would contact.
So is it, forgive me for not knowing this, is it
Sure.
in the charter guide of the Board of Health to have a school representative? Or is this just a practice that you find value in?
The answer is I don't know.
Yeah, I haven't looked at the the makeup of the Board of Health, the underlying, so, I mean, I could reach out to somebody on the school board and start the conversation.
That would be great.
But yeah, and I'll double check. I don't think that there is a particular seat that is held specifically for a school member. I won't say
Okay.
board member, but if you found that it was valuable practice to have that representation, I could reach out to somebody on the board and start the conversation.
Okay. What does everybody else think?
Well, so that goes to a core of what I think that I'm trying to do, which is to get us more tethered to the sources of health issues in the township. And as far as I can tell, most of the health issues either come from the school district or the police department, and many of the issues are managed by our professional staff, by Marie and the manager. But in the absence of having tethering to the sources of our major issues, I think we float. So I think that Mara raises a good point, and it's I do not know what our remit says, what the documents that establish our presence and our remit say, but either way, I think that we can make it a part of our business to have, either as a guest or as a sitting member, somebody from the school board. Would you disagree more?
No, that actually sounds right. I'm just looking at how it's presented on the township website. I'm not looking at the underlying documentation, but it's 9 members, 5 of whom shall be licensed doctors, registered nurses, or persons trained and experienced in public health matters. So 5 out of the 9
members. Right, that's the member.
Yeah,
Right,
but
because the school board
nothing
liaison is
directly
not a voting member.
No.
Well, there is no liaison. I'm a liaison, but there's no school liaison required, or as far as what I'm looking at now. If you'd like to
we
have
could
one,
take
I
that
would
on as
suggest-
an individual on as a liaison.
I think you might be better served to bring them on as a member.
Oh, that's an interesting proposition.
Yeah.
You can have 4 seats of people without trained and experience in health matters. So if it's not the school nurse, it could be somebody else who has an interest in the issues but not trained in them. So you can have 4 seats that don't have that.
That's an interesting
mandate.
proposition.
Yeah.
I like the thinking. So we have an open seat, right? We have 1 open seat left. So
Unless this list has not been updated, you have 2 open seats.
2 open seats. So we do have a seat available. And so if we could get to the right people and make the right connection, we could conceivably solicit the involvement of somebody from the school board or the school district to act as a voting member and sit on the Board of Health. Is that the hypothesis?
I think you get more skin in the game that way. Somebody who's not a voting
I
member.
like what you're saying. So action item from this
Can I say something?
is the modification of the amendments, but Maura, you'll reach out and just, if you could find us an opening or a pathway to move that way, that would be very, very helpful. I'd appreciate it.
Yeah, I'll start the conversation and I'll
Perfect.
circle you in, David.
Perfect.
Can I
Alrighty.
just say one more thing about that? Is the only thing is I would say maybe to leave it a little bit open-ended on their end about the voting versus non-voting or liaison versus member, only because I know some of the school board members might also feel like they already have so much to do. They might feel more comfortable with something that's not,
Yeah, so
I would think that it's probably not going to be a school board member themselves, but that they're the entree
or
deciding who, is a school representative, whether it's staff or,
okay.
Committee member. I'm agreeing with you, Alex. I think it would be asking them to take on, another committee when they've got lots on theirs, on their plates, but maybe they can consider who might be the right person. But yes, I agree. Let's not lock them into a membership if they're more likely to come in as a liaison, just to get somebody at the table.
Yeah. Well, I was also considering somebody from any one of the Radnor schools that could be in a health type of position, a nurse, a counselor, a teacher who teaches health, a physical education teacher. So, but somebody who is directly involved in the health and well-being of the students.
All right, so I'd summarize. I think that we're all on the same page, that
Okay.
somebody from the school district, not necessarily the school board, but with the approval of the school board to join as a voting member of the township is what we believe might be the best way to go. And now is an opportunity with 2 empty seats on the Board of Health to move in that direction.
I think that's great.
Everybody, any objections to that? Any additional, or shall we move on?
Move on. But other than the above, I vote that the minutes be approved.
I second.
So moved.
Okay, moving along.
All righty. So Maria unable to join us tonight, I suggested that that I make a my paltry effort at providing for the group the health officer's report, which I don't know how to share my screen, so I'm just going to review. Marie sent it to me in a PDF form, and so I'll be reading to you from a different screen. So for 5/17/21, dated over Marie's signature, the health officer's report and an OEM report. The health officer's report: all permanent outdoor dining permits have been renewed. There's no change in the 2020-61 extension through November 30th, 2021, and applications for temporary outdoor dining and retail are being submitted, evidenced by an increase in restaurants and businesses with temporary outdoor seating in Wayne. All licensed public pools in the township are required to renew their license at this time. They are all due to expire on 5/31 of this year. They're accepting renewals applications in the office. Radnor Police, next bullet point, Radnor Police celebrated Police Week last week, and the township staff were able to support them during a free event sponsored by Capri Water Ice last Wednesday. Next bullet point, the Great American Pub is ready for their final inspection of their rooftop cafe, which is due to open once they receive their licensing. Marie sends thanks to Dr. Capuzzi for our upcoming agenda item where she has reviewed our township animal ordinance, and we'll get to that in a couple minutes. COVID-19 safety inspections of outdoor areas and outdoor dining continue. Only one complaint in the last month. Don't know the nature of the complaint, and I will really be able to unable to answer any questions that might come up. The American Red Cross Blood Drive is Friday, May 21st at the Radnor Activity Center. If you give blood, you get a free T-shirt.
All right.
And there's a save the date for this, even to help others and support our police, fire, and EMS. American Red Cross will host a Battle of the Badges community blood drive on Monday, July 7th at the Radnor Activity Center from 9 a.m. to 7 p.m. She asks us to spread the word and look for more information soon on all of our media outlets. And I would support the notion that blood during the epidemic, blood for transfusion has been in short supply, and people that qualify and can give, I heartily encourage. And under the OEM heading in Marie's report, first bullet point, there was a meeting today to discuss updated CDC and Pennsylvania Department of Health mask guidance. As of this moment, our building protocols remain in place. Once the discussion takes place, the board will be notified of any updates. So I haven't received any updates as of yet. Continuing daily case counts of Pennsylvania, Delaware County, and Villanova University cases are being undertaken. The staff is continuing to get vaccinated, and there have been no recent exposures or cases of COVID-19 within township staff. And the Office of Emergency Management welcomes any suggestions of the board regarding the mask update. So when we get to our COVID updates, if we have a chance to have a robust conversation and there are ideas about how we might go about doing that, any suggestions, then let's take that up at that moment. So with that, unless there are any questions, which I probably won't be able to answer, I suggest we move on from the health officer's report, and I'll thank Marie for her report. And
I have a question. I don't know if you can answer it or not, but just the thing about the rooftop inspection for Great American Pub. I thought we were in the middle of replacing our health inspector. Am I misinformed about that?
I'm not sure what you're saying. So you mean?
I thought our health inspector had left and we were looking to hire another one.
So Marie does.
It's a health
Inspections.
inspector.
It-
So Marie leads that.
Right. So Katie
Okay.
was working with Marie, and I guess Marie is shorthanded, and we are looking to
Okay.
hire, but Marie does those inspections as well.
Yeah.
Okay.
Okay.
Uh,
Actually, we had an answer for your question.
All right.
Yay.
David, can you send me a copy of that, please, so I can use it for the notes?
I certainly
Minutes.
can.
Thank you.
Yes, absolutely. Although I think what I'll actually do is ask Marie, Marie too, but because it's her report. But yes, we'll make sure
Okay.
you get it.
Thank
right.
you.
Thank you. So with that, let's move on to what I've listed as old business, but I think that they're actually both ongoing business. And the first item on the agenda for old business was an update report from Ms. Garamflo, who has been kind enough to join us and to give us an update on proceedings with regard to I don't want to say it wrong, a county board of health. Is that appropriately stated?
County
Okay.
Health Department.
The county health department. Now, not
Yes.
exactly the same, correct?
Correct.
and can I
And
be-
we'll have, it
before we-
has a Board of Health, but
Right. So
yeah.
so within a health department, there would be a health commissioner and a board of health and other things, right? So
Yes.
can I ask that without putting too much of a burden, are there org charts? And
Don't have, I can talk to you about the services that will be provided. We've drafted org charts, but they're tied to the budget, and the budget is still being developed by another consultant. And so my understanding is that all of that will be released at the same time.
okay, so I guess what I was more interested in getting at is what is the enabling legislation that led to the establishment of a health department, and what is the remit of that health department with regard to what are the boundaries and guide rails around what are the documents that drive your ability and the structure and budget that you will have, and if that is that, I assume that's publicly available and
Oh, yeah, absolutely, absolutely.
if
And the
it-
budget will be publicly available as soon as it's, as soon as the study's been finished. So
So
Act,
if offline, you could send over the enabling information, that would be great. If
Sure.
that'd be wonderful.
sure, and it's all in Act 315 of the Local Health Administration law in Pennsylvania. So I can send you a link to that.
Wonderful, thanks. And with that, I'm going to turn it over to you.
Okay, is it okay if I share my screen and show you some slides?
It'd
Sure.
be wonderful from my point of view, but I can't enable you to do that. Ian, are you with us?
It looks like I can.
All right, wonderful.
Can you all
Great.
see my?
Yep.
Whoops. Can you see a slide or do you see something else?
I see a slide, strategic goal number 1.
Okay, perfect. That's exactly what I want you to see. Okay. So we have, what I'm going to do by way of update is to share with you where we are in terms of our strategic plan, and also where we are in terms of the steps that we need to go through to become a county health department. So we set that we have a steering committee that's overseeing everything, and we developed a strategic plan last fall, and that's been guiding the efforts. So the first of our 4 strategic goals, as you can see here, is to secure and support and also funding for the health department. And so we've been working with the other county muni health departments, as they're known across the Commonwealth, to increase the Act 315 funds. So Act 315 is the enabling legislation. And if county and community health departments receive a per capita amount of funding to support their health department, if they choose to go this route. And the act has never been fully funded. So right now, those 10 county munis have not been getting the complete share of funds as laid out in the legislation. There is an escape clause, and that's why. But we did not want to come in and have the pie cut into 11 pieces instead of 10. So we've been working with our delegation, with folks in Harrisburg, and also with other county munis to increase the level of funding to Act 315 to where it should be based on what is stated in the legislation. And what I can tell you at this point is that that amount has been included in the governor's budget, but we don't know. We don't know yet what's going to happen, but fingers crossed. I mean, we're really hoping for bipartisan support. So we'll see. We've also been working hand in glove with the state health department. They're very supportive of our effort, and they are connecting us with all the different bureaus that we need to talk to, because those are other areas where we'll be getting funding and needing to follow certain regulations. So that's completely underway. And we have not yet developed a strategy to secure other financial resources. That's going to be a little further on. We realize that there's enough to do just to become Act 315 compliant, that we really just needed to focus on that before we started branching out. So that is where we are with this first strategic goal. Oh, any questions about that before I keep going? Okay. Goal number 2 is to generate public support. So you all know that that the reason that this has moved forward after decades of discussion is because there is a new county council that was voted in, first time ever Democratic control. And so we're well aware that, you know, there are a lot of people in the county who aren't necessarily supportive of having a health department. Not only that, COVID has really, you know, I think has polarized people in terms of how they feel about public health and public health departments. So we're hiring a communications firm to assist with a public awareness campaign. The campaign is going to be built off of publicly available materials that have an evidence base in terms of terms that do resonate with people, as well as terms to avoid, to help people understand what it is that public health does and what the value add is. So that work is going to commence in about a month or so. We have some other efforts we've undertaken, but this will be a much more comprehensive effort so that people all across the county have a better understanding of what it will mean to have a health department once that's rolled out. Any questions about that? We also, the third goal is to make sure that we engage as many people as we can in the planning process. The reason for this is that the health department is as outward facing. We're building a very modern health department according to national frameworks, and they really call for convening a number of different organizations and working across sectors and really listening to the community to achieve the mission of the health department. And so we've had a series of learning sessions. I looked back it doesn't seem like it was that long ago, but the first time we met with you all was in February. So we've met with 24 different groups, 25, from a number of different sectors and a number of different community-based organizations. And this is what we called our listening tour with our listening sessions. And we learned, we've gotten really, really good input in terms of what people see as health priorities, as well as how the health department really needs to work with people in order to achieve the mission of having the county be a place, a healthy and thriving community for everybody. We also, and this is one of the reasons why we're always interested to come and talk to you all, we've also been meeting with the Council on Governments and working on a transition plan for inspections, since the health department will be taking over those inspections. So that's another piece. We've got an outreach plan. We're having our third meeting with the Council on Governments next week. And then we are going to begin one-to-one meetings with every municipality. The other piece of having the listening sessions is that because the health department really is going to work in partnership with a lot of different players, we wanted to start now helping to establish those relationships and make sure that nobody's surprised when we're ready to launch the health department.
So
And then
before we go on there, I heard you say something that wasn't, so that when we have a county health department, the plan is for the county to take over the responsibility that we discussed during our health officer, the licensing and inspection responsibilities around facilities in the township?
So we're working with the state to understand what exempt municipalities are. Most municipalities, we know that at the least, most municipalities will not be exempt, which means most municipalities will be taking those over from most municipalities. We don't know yet about Radnor. We're still talking to the state and getting some clarifications, but we anticipate having a handle on that probably later this week.
Okay. Thanks.
Any other questions? Okay. And then the fourth goal is to establish the health department programs and get the health department up and running. And so we had, as I just described, we've had listening sessions really to get input, just basically what is it that people want us to know and what kind of advice do they have for us and how do they want to work with us. When it comes to the programs, we are beginning to hold program-specific think tanks. And that's where we come to the community and say, here are our preliminary plans for this specific area. Tell us what you think. Opportunity to solicit feedback before we finalize any specific plans. We also, and at this point, have met with all of the program leads that we need to in the health department. I mentioned that earlier in terms of our routine meetings. With a financial plan, as I mentioned, we have the economic study out being done, and hopefully that will be finalized sooner rather than later. They're getting close to the end, so that should happen pretty soon. And then Mr. Lazarus, county executive, is very wed to performance management systems, and that's also a requirement for a county health department to become accredited, which this health department intends to do. So that is a piece that's going to be built into the program plans as well. Okay. So those are our 4 goals. Had another piece to share with you, but any question about this one or any of our strategic areas? Okay. Hopefully this is big enough for you all to see. Act 315 funding. You have to go through a series of steps to get it. And so just to let you all know, we received our certificate of approval in January, and immediately thereafter, the county passed a resolution to authorize a county health department. Board of Health for the county was just appointed a few weeks ago, and their first public meeting is going to be, I want to say June 2nd. I think they're going to be the first Thursday of the month. We're currently, we're about to start recruiting for a health director. We're hoping to get somebody in midsummer. The next step is to prepare the health department. So this is getting all staff on board, equipment, materials, policy and program plans, et cetera, et cetera, et cetera. And that is, that's underway. And after we've done that, then we are going to request, we're going to submit our proposal to the secretary, November 2021. This is not NA, it actually should read TBD. We're still figuring out what we need to do with respect to all of the municipalities, as we just mentioned. But then we'll submit our proposal after the health department is staffed up and prepared. And we'll do that in November. We anticipate hearing by January, maybe a little sooner, but who knows because of all the holidays. We anticipate getting approval. And then 30 days immediately after getting approval, we need to let everybody know, the municipalities know that we've gotten approval, and 30 days after that is when we launch.
Who's responsible for providing approval?
Who's responsible for what?
You determination of readiness. It says.
Oh, it's the secretary. So we
Secretary,
of health.
State Secretary of Health.
Yeah.
Fine.
Sorry. Yeah. Possibly interim secretary. Yeah.
I have a question. Who is responsible for appointing a board of health? And is that a paid board of health or is that a volunteer board of health?
It's a volunteer board of health, and county council is responsible for that. We put out a call for applications. We received 85. It was a highly competitive process for 5 seats.
Nice.
And they were just appointed 3 or 4 weeks ago. Something like that in April.
Got it.
Yeah, and by as per Act 315, we had to have 2 physicians and 3 non-physicians. And not surprisingly, everybody has to be a resident.
How many are on the board of health?
5. So
Total of 5. Wow.
total 5, 2 physicians, 3 non-physicians. And that's all in statute.
Okay.
All right.
Okay.
Would it be helpful? I've got a couple more slides I can share in terms of building it out in phases so you can see what the health department will be providing. Would that be helpful?
Sure.
Okay. So these are overlapping phases that you see here. The first one that I'll show you here, you can see is what is going to be the health department's focus. And then the next slide will talk specifically about services. So the first phase we have starting in 2022, January 2022, when the health department is launched. And we anticipate it will take between 12 and 14 months to get everything up and running. And the emphasis in this first phase is going to be on doing just that for the required services by the state, as well as developing the relationships, getting out there, serving on the right coalitions. The health department likely will need to start its own committee for health improvement planning processes. And then also data. Data collection is going to be a key function of the health department, collecting as much data as possible and making it as locally relevant as possible. We have all kinds of data sources that can tell us things like county-wide averages. But a couple things. A lot of those databases give you data that are 2 or 3 years old, just the way it works. And a lot of it really just does end at the county level. Well, you all know in Radnor, I mean, Radnor, right? And you know how different Radnor is from other municipalities. So what we will be doing is collecting data to the degree possible at the municipal level, zip code, census tract, and as low as we can go. So we really understand the needs throughout the county, and that will be an ongoing function of the health department. When it comes to phase 2, we're saying that phase 2 starts in 2023, only to indicate that we figure it will take definitely a year to get everything up and running. And beyond that, we're not quite sure, but we want the director to have some wiggle room. We certainly don't want to hold back on anything. So by 2024, phase 2 will be in full swing, although we imagine that this work will be happening before 2024 actually starts. And this is to get more resources in and to make sure that we have what we need to meet priority needs that are not met by the Act 315 requirements, and I'll show you some examples of those, as well as I mentioned that the health department plans to get accredited, so there is some capacity building that will need to happen, again, outside of Act 315 for that to happen. And then phase 3, we anticipate that the health department will begin the accreditation process in 2027, and otherwise the health department will continue to work with partners to achieve the mission of public health. And then here, let's look quickly at the programs that will be provided. So phase 1, the health department will be providing both immunizations, both for children. It's a limited population that they can give for children, but also some adult immunizations, maternal and child health services, which because of the available funding, they won't be terribly extensive, but we will be working, that will mostly be a community-based program to work with communities where there are high rates of maternal and infant morbidity and mortality. And we are in the process of identifying those communities now. And then also communicable disease control. And everything that you see, well, under personal health, everything you see under personal health is currently being done by the state health center. Those are things that we'll be taking over for the whole county. And with the communicable disease control, you can see that includes HIV, TB. There's a large TB problem in the county. You all might not be aware of it. I don't know how much you all have in your township, but it's pretty significant. And a lot of gonorrhea and chlamydia in the county. It's really up there, one of the state's highest rates, actually. For population health, we've been doing pandemic response, and we'll also be taking on general emergency preparedness and response. Disease surveillance, again, that's something that is being done for us by the state, but we'll take that over. And same with health education efforts countywide. And then finally, the environmental health inspection pieces that we've referenced a couple of times. So that's the basic, those are the core Act 315 services. Now, when we get to phase 2, we're anticipating bringing more money into the county, first of all, for case management. As I've heard somebody say, which I love, the county is resource rich and coordination poor. And most people who seek assistance with health-related services end up getting a list of agencies to call. But if you're already in crisis, you don't really have the bandwidth to navigate all of that. So we'll be bringing in resources to assist with case management. Not only that, there's a huge there are huge inequities with respect to infant mortality. Babies who are born to Black mothers have a 3 times higher chance of dying before their first birthdays than babies born to white mothers. And so we will be, again, we will be addressing that from the outset. However, we anticipate trying to bring in, trying to get more, as an example, get more doulas trained, as they have been, that's been proven to improve birth outcomes, both for mom and for baby. When it comes to some population health issues, what we've been hearing from people, well, we know, first of all, that violence prevention is going to be right up there. Assault is the number 4 cause of death for the Black population in Delaware County, and firearm fatalities are 3 times higher in the Black population than the white population. So clearly, that's something that we're going to want to address, along with housing security and food security. That's come out loud and clear in our listening sessions as real concerns throughout the county. And again, we'll be working with the community and with the community partners to address these things. And then finally, despite the inspections that are going on, and it's great. I mean, every municipality is doing them, and best we've heard, they've been done very well. However, those are not the only environmental health concerns that we have. Air quality issues, sometimes, and we might find that there are soil contamination issues as we venture into environmental justice, and that is looking at where people live around hazardous or previously hazardous sites, and lead poisoning prevention efforts. Right now, what the county does is follow up if a child is found to have an elevated blood lead level, but there aren't any prevention efforts out there. So that's something else that we'll really need to move into, much more effective, as you all know, to prevent a problem than treat it later. And this is not a class issue. People who remodel their homes, people with higher incomes who remodel their homes, can run into lead poisoning in their kids. So anyway, that is another area where we anticipate bringing in more resources and having more robust presence. And then you can see 2027 and on, we're not sure what the future holds at that point. We just know that, again, we'll be working with partners to bring resources into the community to achieve the health department vision, which is what you see in that last arrow there. I used the point about bringing additional resources in because the role of the health department is not necessarily to make the health department bigger. It's to work with other sectors, provide health-related data, help people make connections, convene groups, and do what we can to make sure that the county has the resources it needs to be healthy and thriving. And sometimes that will mean that health department has additional programs. Sometimes it means the health department is working to bring resources in for other sectors and other organizations. So hopefully that didn't exceed. I think I went a little over 15 minutes.
We do have to keep moving. And
I'm so sorry.
Very helpful.
No, it's very interesting.
Very helpful.
Very helpful.
We are exceedingly grateful for you to come.
Thank you.
There's Jane, I think we need to move on to next agenda item. So what I would suggest is that we formulate any questions that we may have. We get them back to you offline. I would suggest that we bring you back, or we suspend in the summer, July and August, and start back up again in September. So I would suggest that we bring you back in either our September or October meeting for another update, and keep this going as a dialogue. And there's a number of things that we'll have to do offline on our end to make sure that the communications are going. And I'm sorry, I think there are a couple people that have some pent-up demand here. I do want to get on to Joan's animal ordinance. So if there's
I'm going to go ahead and I'll put my my email in, and don't hesitate to reach out, and we'll certainly be in touch, and I'll look forward to joining you all again in the future.
Great.
That would
Thank
be
you.
great. I just have a quick question. Is the slides that you showed, are they available anywhere?
I will send them to David and Marie. And
Great.
Excellent. Thank you so
Okay,
much.
take care,
Really
everybody.
informative. Thank
Thank
you.
Great, I'm
Very
sorry I
well.
ran over.
No,
Okay.
don't be sorry.
Excellent.
We're really
Excellent
appreciative
information.
of the fact that you took the time to come and talk to us and provide such a well laid out presentation on what's going on. We really appreciate it.
Thank you
Thanks.
so
All right,
much.
have a lovely evening. Bye-bye.
Bye-bye.
Bye. Thank you.
Yep, sure thing.
Joan, are you ready?
Well, let me just, Joan, what you did is amazing. You put so much time and effort into that. And I was blown away how antiquated those ordinances were. So
Yeah.
thank you for all the time and effort you put into it.
Oh,
I
sure.
could not agree more.
Thank you for
So
mentioning
second.
that.
it- So we have about 15 minutes left before people start dropping out. And I think that this is the bulk of what we need to do. So Joan, I don't know how you want to organize it. I've been through your marked up in detail, and I certainly there were a couple of questions, but I certainly didn't have anything that I took issue with. So I don't know whether you want to go through it or do a top line. How do you want to handle this?
Well, I mean, I guess most of the changes I made really had to do with bringing it up to speed with the current state rabies regulations. Can you hear me?
I can.
Yeah.
Oh, okay. So that's most of it, it looks like, and there were a few grammar things. I think throughout this document, it mentioned the director of community development, who I think really it should be in the hands of the animal control officer, who is William Gallagher. So the rabies issue is one thing. It's probably this animal ordinance as a whole should be weighted more heavily, honestly, by other things. Rabies is extremely rare. It's kind of an outlier thing that rarely occurs, and obviously all the vets in the area are under control, in control of that, of keeping everybody who goes to vets, which is most of the people in the township bring their animals to vets. So I think they've got a handle on that. I don't know that the township has to get so involved in that, although they do have to obviously enforce, and where that comes from is typically from the veterinary office, who then notifies the health department or the township that, this is what's going on, this is the protocol, or the bite is reported directly to the police, who then inform the animal control officer, who then requires that paperwork come back from the vet, for example, with, quarantine and exams, and does the animal look free of rabies, and blah, 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 blah. And then, of course, the hospital emergency rooms know how to deal with the people who have, potential post-exposure issue. So that's that. I mean, did anybody have any questions on the rabies updates?
No.
I had, go
ahead.
ahead. Jane. I'm sorry.
No, there just were a couple of, I don't know what edits that I would recommend. Should I send them to you personally?
Yeah, sure. Or we could discuss it now, whichever.
But one of them is reports of animals bitten or injured. It says to immediately report to the animal control officer. The problem with doing that, in case it's, a violent bite, sometimes the animal control officer is not available, and it's the police that you need to get in, to control either the animal or the owner of the animal.
Right.
So maybe that was removed, maybe reinstate that.
Where is that? Is that the end?
115-5.
115.
So my experience has been that the police serve essentially as the animal control when the animal control officer per se is not available, and then accept responsibility for coordinating animal events back with the animal control officer.
Right.
Where is it? 115.5?
Yeah, 115-5. On my,
Oh, okay. Reports of the animals bitten or injured. Okay.
Yeah.
And
and then the only other one, just little stuff here and there, but is that how do you, if Delaware County requires licensures for I don't know if it's just dogs or dogs and cats. I think it's just dogs. Can we as a township not require that if the county requires it?
I think if it's a county license, then the county can require it, but I don't think it's up to the township to then have another township license. And to me, from this document, it looks like there's another township license.
Okay.
But I think it's the township. I don't think it's the county.
No, I know Delaware County requires.
Then if Delaware County requires it, I don't think we can usurp that. But
Right.
what it looks like from this document that it's suggesting that there's this township license.
Yeah,
I would suggest that you guys have identified a clearly important point, and that we need clarity there, because we don't have the authority to recommend discontinuing. If there is a township licensing, your recommendation would be to discontinue, and I don't think we could do that, but we can make that recommendation. And Maura, would that be through the Board of Commissioners, or would that be through the manager, the township manager?
Yeah, I think it would have to come in front of the board as an ordinance, but I do question whether we can sort of preempt the county. We can't, I'd have to look.
I think we agree.
Oftentimes you can't go more restrictive than the
So
county.
the point would be that if there is county licensing, we just may need to make sure that our ordinances.
Township, I don't think it's the county.
Say again?
Where was
Yeah,
it?
I was about to reach for my dog's collar to see who issued her license. I looked over, she's not wearing it. So.
Go right to the source.
Yeah, this was under Article 2, rabies control. You recommend discontinuing licensing requirements. I was just concerned that
So I think we need to
dog
we need
like
to
by
check out-
appropriate agency of Delaware County. I mean, if it's required by Delaware County, we can't not allow that. No,
we can't not allow that.
We're all in
Why
agreement.
don't I know this? I worked in Broomall for how many years?
We can't supervene the county,
But
and we don't know if there's a township, so I don't think we
Yeah,
can
but
solve that without further.
okay, we'll have to look into that.
So here's how I suggest we proceed, if there are other comments from other people with questions or modifications, let's take those on. But I think process from here, Joan, maybe you and I work with Marie, and I think we need to work with both Kevin Kuczynski and Bill Gallagher to see what we would need to do to enable the changes that you suggested. That was the only one that I saw, that what Jane raises about a licensing was the only one that if there is a township license, we need to figure that out. If it's county, then we need to make sure the wording.
I'm pretty sure it's by township.
Okay, we'll look into that because
Lower Merion Township has a license. Radnor Township clearly has a license. So I think it's by township.
Okay, well, we'll look into that. Just one other thing, just food for thought here. What about the large animals? Like, I know that I remember in Lower Merion, it had to be X number of acres per animal,
Yeah.
Do we have anything like that in Radnor Township?
I think that's something that we need to get more information on, and I think it should be in the ordinance. Right now, for
Sorry, I
example,
missed that one. Say that again.
Sorry.
I missed the issue that was
the
questioned.
issue is whether there are allowed to be like livestock, hoof stock, chickens, all that, farm animals
Well, there are
allowed in the
cows on
township and what the
Ardrasan.
requirements are.
There are cows on Ardrasan.
Well,
I
there
was about to
are.
say
and the
there-
cows-
yeah,
the
there are-
cows Are
There are
grandfathered in.
restrictions. Certain areas can't have chickens, some can,
Yeah.
you know, I think
So
it's
the
a
cows-
density issue.
Yeah, who,
The cows are grandfathered in because that is considered agricultural property.
but in
If they
private residence,
subdivided it, for instance, I don't think the people, for example, who've bought some of the ground could have like a goat in their backyard without a special.
Goats.
Goats are
But-
awesome.
but I
They're
know,
awesome.
Goats are allowed in the township.
but I also know that a lot of people have, chicken coops now. That's a
Mhm.
big thing. And who is allowed to have them, who is not? And, can a neighbor complain because the rooster's carrying on at 6 a.m.?
We've already been down that road with the chicken ordinance, and we've tried to introduce it several times in the last 8 years, and the Board of Commissioners has not been amenable to it for a variety of reasons that don't make a whole lot of sense. But it would be great because a lot of people do want to have them, and a lot of people have them illegally right now.
Okay.
I do think it's something that we should look at, but I've tried, a number of people have tried, to no avail. As far as cattle, I mean, I think we do have to mention that, for example, there was one calf, I believe, 2 years ago that was rabid. So I think the cattle have to be integrated into this document. I don't think there are any horses in the township, and I don't think there are any horses allowed at this point, but I don't know who, makes that determination, or if that's a formal thing, or if just nobody has them, but I'm not aware of any horses or.
Yeah,
goats.
Valley Forge Military Academy comes to my mind immediately.
Is that Radnor or TE?
It's
Radnor.
the
Radnor.
Radnor. It's Radnor.
It is.
I know that because when we did that Radnor Police Academy, my husband went on a ride with one of the police officers, and that was covered by Radnor.
Okay. So I guess that needs to be, if there are horses in the township, that all has to be incorporated in here as well. And horses do need to be vaccinated for rabies as well.
So I think you did amazing work on what you did. It sounds
you.
like there are a couple of issues that we need to clarify,
Yeah.
and then we'll need to put together a plan for how this would be implemented. I think we can take that offline. What I suggest is anybody who has any issues that were not raised in this, by Maura, in
I
this.
am really sorry. And
It's okay.
Thank
Joan,
you.
I would like to talk to you about this offline, so I'll reach
Great.
out.
Okay,
Okay.
so that's what I
Bye-bye.
say, we should set up a communications cascade offline. And I'm sure that we're going to have to work with the animal control officer and with the community development director to figure out among these other issues. So what are the other issues that we need to, licensing is one of them, cattle and other livestock.
Species are allowed in this township. I think it needs to be really clarified what is allowed and what isn't allowed.
So let's figure out what are the other issues and how we can create a pathway to get agreement, and what of that agreement that we might be able to achieve. What would be a pathway to clearing the Board of Commissioners and making this happen. And I think that, to me, of all the things that we've worked on, the most direct, impactful with regard to township ordinance, this is one, and I think we're all really grateful of the work that you've done thus far, and I'm making the assumption that you're willing to continue
Yeah.
in this vein. So I hope that that's a valid assumption.
Sure, yeah. And I believe, for instance, like in Lower Merion Township, they do allow chickens, but where we were in the process of doing a whole chicken ordinance, they just have one paragraph in their animal ordinance. At least that's how it was several years ago.
So if you have their copy of their ordinance, I'd love to see that. That'd be great.
Yeah, I have a copy of it somewhere. I'll get it.
So here's
But
what
I
I
think
suggest.
also, I do
Go ahead.
think, and I felt this way for quite a while, and I kind of addressed it before, that I think we have such an ecologically rich environment that we're, gradually in the process of destroying in this township. But I think we really have to make concerted efforts to be respectful of the wild animals in the township and be like a little more ecologically cool about things here. There's not a single sign, not one deer crossing sign. And it's amazing to me when you have so many cars, so many people, and so many deer, the answer isn't to go shooting the deer on people's property. The answer is, let's have some signage.
Well, we do have some signs around there.
I have yet,
Not,
what signs?
I
I'm
know.
going to intervene with executive. The deer question could be a long conversation.
Right.
We have
It could
folks.
be a long conversation, but I think we've got to have lots of signage. We've got foxes, raccoons, tons of things. And I think we need to be a little more sensitive to that in this township.
So
And
I think that that's the kind of thing that we can work on moving forward, get agreement at the board, because that all of that will have to go through commissioners and through OEM and the police. So I applaud efforts that we can make to upgrade the way we do business, to upgrade quality of life is what you're talking about. And I think that would be an important contribution of this board.
okay.
Okay, so offline, we're going to work on this particular project as well on the animal ordinances, as well as trying to put together what else we can do as a Board of Health that would expand our impact in that regard. So I'm going to move forward here. My COVID update will be quick. I think we're doing really well. I think there's going to be a lot of progress. Please go get your vaccination if you haven't had it as soon as you can. That is what will keep us from taking giant steps backward and allow the progress that's being made. I think we should expand our time spent on that at our next meeting, as well as continue this. I am going to be a little peremptory with the student interns in the absence of anything that I'm aware of in terms of clearly definable progress on the project. I'm going to suggest that we set aside time for your final report at our next meeting, at our last meeting, and ask you to come prepared to spend some time. And I think we'll have to figure out what our time allocations look like, and we'll let you know before the next meeting. Is that okay with you guys? Okay with you?
Yeah, I just had a quick question. So I saw in one of the student intern projects from like 3 to 4 years ago, I think I forget exactly what the topic was on, but it was like diet and something with the cafeteria food at the high school, and she interviewed like students at the high school and one of the cafeteria staff. And with our project, in my medical careers class, we had a mental health research paper, and then we talked a lot about like the problems with our mental health curriculum at school. And a lot of my classmates were really passionate about talking about that. So I was wondering if I can get like a statement from one of them, since I saw that it was possible.
Statement from one of the students or a past intern. Who is it you want the statement from?
From my classmates.
The only thing that concerns me again is privacy rights, and I don't know if you can do that or not, because you are getting personal information, and I don't know, but I don't know if you can do that.
I would feel uncomfortable sharing unsolicited or solicited testimonials in the absence of health information protection. And I wasn't around when those were done, so I don't know what the preclusions are. But I would tread lightly on that. So I'm gonna, again, in interest of respect for people's time, I'm gonna ask that Suman, if you would loop back with Jane and Lisa on this, and we'll see what can and can't be done, and move forward offline, if that's okay.
Okay.
Good.
Yep.
Future projects we've already defined, and we don't have public participation tonight. And I'm going to ask somebody to move to adjourn.
I move to adjourn.
Second. Charlie, you okay with all this?
Yep.
All righty,
All
thank
right,
you.
thank you, everybody.
It was a really kind of an action-packed meeting and
Yeah,
a
it was
lot
good.
of cool stuff. And I appreciate everybody's hard work and we'll see you in a month.
Great, thank you.
Thank you.
Thanks.
Thank you.